Hello, my name is Ralph Hills. I live in Connecticut, and I'm the patient chair of Know AML in London. I'd like to talk today about long-term treatments and how they have a major impact on patients' lifestyle. There was a survey done that said it has a major impact, and it really varies depending on where you live and your health conditions, but it does confirm that long-term treatments can have a major impact on your life. I am one of those patients, and I agree with the survey results. The big question is whether the treatments meet the overall goals of each individual patient and their families. I was diagnosed with AML 10 years ago. I was treated in a clinical trial for 4 years, followed by maintenance therapies, combinations of infusions, and oral drugs. Yes, there has been tremendous progress in the treatment of AML these past 10 years, but I still feel there are the same 3 possible outcomes of an AML diagnosis. The worst case, of course, is an unsuccessful cycle of standard of care infusions and transfusions. The best is a successful transplant of some type, leading to persistent remission. I was told I had a 60% chance of transplant success, so I never had a transplant. And the third possible outcome, long-term treatments that try and keep AML under control and remission. We must remember that AML outcomes vary based on mutations, geographic locations, access to qualified AML clinicians, and the most modern drugs. And now research and clinical trials have produced revolutionary maintenance options, allowing some AML patients to now actually have good quality of life days, even years. If these treatments keep us alive, why does the survey show that so many AML patients feel maintenance treatments are a major impact on their lives? It's because these treatments are a challenge. For example, I drive to a hospital 5 days every 6 weeks for infusions. There are side effects, nausea, pain, risks of infection, digestive tract issues. There are travel issues, prescriptions, and financial management, impact on jobs and daily lives. I actually withdraw from normal life these 5 days to recover from each infusion. And for some, anxiety and worry, stress, feelings of isolation, and all have the constant worry that these treatments will fail. But we must remember that if we are fortunate enough to have caregivers and family support, they are also affected, sometimes by their own physical and emotional challenges. Caregivers and family have their own lives to live. But we must have hope. Progress is ongoing. My infusion schedule has been reduced, allowing longer time for recovery between treatments. A great solution would be just oral drugs, of course, and we see that happening. The greatest progress will be when our treatments become cures and we are free of AML and treatments. Yes, I agree with the survey that maintenance treatments are a burden, but they keep me alive, and I am grateful every day. Everyone who answered the survey makes decisions about longevity, quality of life, and independence. I wish everyone who sees this video the best. Sometimes during these good weeks between treatments, I even forget I have AML.